Listen up, beautiful nerds. Imagine going in for a haircut and leaving with a missing tooth. For centuries, barbers did more than just cut hair, they also performed surgery. In medieval Europe, one of the most common medical practitioners wasn't a physician. It was a barber. While physicians focused more on theory and diagnosing the thinkers, barber surgeons were the ones doing the actual work. And by work, I mean the cutting, the stitching, the pulling teeth, and even amputating limbs. And some of the earliest barber surgeons were, of course, connected to the church. In medieval monasteries, monks were required to maintain a shaved area in their heads, known as tonsures. So, barbers were brought in to keep it shaved. And it didn't stop there because we wouldn't be making this episode, my lovely friends, because while the members of the clergy were restricted from performing surgical procedures, somebody had to do it. So, barber surgeons started taking on minor medical tasks like bloodletting, and over time it expanded. Now, barber surgeons didn't just stick to the basic procedures like bloodletting and tooth extractions. Oh no, my friends, they performed a wide range of operations. They pulled teeth, they treated wounds, they set bones and dislocations, they cut open cysts and boils, and they even prepared ointments. And in some very serious cases, they did amputations, especially in the battlefield. Now, when it came to tooth extractions, well, all the procedures, just keep in mind that there was no anesthesia at the time. So, when it came to tooth extractions, barbers use a metal tool to grip the tooth and will pull it by force. That sounds so savage. Sometimes the tooth would break, leaving fragments behind, which could cause infection or ongoing pain. And because there was no real understanding of sterilization yet, removing a tooth could become extremely dangerous. Barber surgeons worked in a variety of settings. Some of the earliest were attached to the monasteries, but over time they began working independently and they started working in barbershops in cities and towns. Now, these shops became a place where you can go to get grooming or medical treatment. I mean, think about that. You could go to a barber shop and get a tooth extraction or a haircut by the same person. They were used by both the poor and the wealthy, offering more accessible care than physicians, which again is so wild to me. They were also heavily relied on during times of war. They were treating injured soldiers on battlefields and military camps. And in some cases, they could even be called to the home to do procedures like tooth extractions or wound treatment. And the tools they used, my friends, were simple as you can imagine, but very brutal. We're talking about knives, bone saws, forceps, tooth extractions. For gunshot wounds, they use bullet forceps to remove the bullet, and if the bleeding became severe, they used heated irons to cauterize the wound, burning the flesh to try to stop the bleeding. That just sounds so painful. Also, keep in mind there was no sterile equipment, just metal tools and whatever they could do to keep someone alive. Speed mattered because the longer the procedure took, as you can imagine, the more pain and the greater the risk of blood loss and even infection. There was no understanding of infection at the time, and very little they could do to manage the pain. Sometimes they used alcohol for the pain, or opium, or both. Patients were fully awake a lot of the times. But when these procedures went wrong, my friends, they went very wrong, as you could imagine. Surgical mortality was high, patients could lose too much blood, go into shock or develop infections. At a time when there was no understanding of the germ theory yet, even a procedure that seemed successful at first didn't guarantee survival because infections could develop days later. And very often, there was very little they could do to treat them. In many cases, the treatment itself was just as dangerous as the condition. Barber surgeons were especially important during times of war because they treated injured soldiers often immediately after battle. Gunshot wounds, severe trauma, crushed limbs, in many cases, unfortunately, amputation was the only option. Now, as you can imagine, amputations were some of the most extreme procedures that they performed. They were often done when injuries became severe, especially on the battlefield. If a limb became damaged or began to decay, it was seen dangerous to leave untreated. Makes sense. So the solution was to remove it. Not because they understood infection the way that we do now, but because they observed that when these conditions worsened, patients often died. The limb would be removed as quickly as possible, sometimes in a matter of minutes, not all the times for precision, but to reduce pain and, of course, blood loss. But even when the procedure itself was successful, survival wasn't guaranteed because of the infection and the shock and even the blood loss, which were constant risks. But of course, my beautiful friends, not everyone agreed to these procedures. Rightfully so, they should question these procedures. Amputations, in particular, were, of course, very terrifying. And some patients refused surgery. I do not blame them, okay? Even when it was your only chance of survival, I probably would be like, let me go. Others delayed treatment, hoping that their condition would improve on its own because the procedure itself was so extreme and so brutal. Again, I do not blame them. That for some, the risk just didn't feel worth it. In many cases, patients chose to endure their injury rather than go through the surgery. I am patient. And it didn't stop at limbs, my lovely friends. In many cases, procedures were being performed on the skull itself, and I don't mean trepanation. We'll do a whole episode on that. By the late 18th century, procedures like craniotomies were being performed, sometimes with the involvement of the barber surgeons or surgeons trained in similar practices, using substances like opium to dull the pain, but without modern anesthesia or any real understanding of infection. Just some skulls being opened. Dun 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 dun. Now, they also practiced bloodletting using razors or leeches to remove blood from the body because they believed it could restore balance and improve health. If you want a deep dive on this, bloodletting deep dive is linked to the description. That deserves an episode on its own because it's very fascinating. Over time, barber surgeons began organizing themselves into guilds. These were professional groups that controlled training, set standards, and decided who was allowed to practice. This is a good thing. In some places, this helped separate trained barber surgeons from unskilled practitioners and gave the profession more structure. Now, this is where it starts getting very dark. I mean, it was already dark, but you see that barber pole, that red and white barber pole you see today? It's not just decoration. The colors actually mean something. Allegedly, the red represents blood, the white represents bandages, and in some versions, the blue stripe often represents the veins. But the pole itself is believed to come from the staff the patients gripped during the procedures. Savage. Now, becoming a barber surgeon didn't start with surgery, good thing. It started with shaving. Training was typically done through apprenticeships where beginners first learned how to handle a razor before moving to medical procedures. And over time, they took more complex work like bloodletting and amputations. The social hierarchy from back then is always going to fascinate me because despite the work they did, barber surgeons were not considered equal to physicians. Physicians focus on theory and were seen as higher status, the thinkers, while barber surgeons did the physical labor, which is very interesting because today surgeons are one of the most respected in the hospital settings. Psh. Over time, medicine began to change, of course, and even though in 1540 barbers and surgeons were grouped together in London, as medical knowledge grew, surgeons wanted to be seen as more skilled and formally trained, separating themselves from barbers. So by 1745, they officially split, forming their own profession. As medicine advanced, surgery moved into hospitals and became a specialized field, and barbers returned to grooming. So, for hundreds of years, some of the most dangerous medical procedures weren't performed in hospitals, they were performed in barber shops, where a haircut, a tooth extraction, or even an amputation could all happen in the same chair. A reminder that modern medicine survival often depended on whoever was willing to pick up the tools. Don't cheat on your barbers. Thank you for watching, my beautiful, lovely friends. Stay safe, stay weird, stay curious. I am Glory from Archives of the Centuries. I'll see you in the archives, my historian friends.